Mental health is a vital part of our society. I don't think anybody in this chamber would disagree. Families and communities right around the country have been broken with regards to heartbreak and tragedy when it comes to mental health in recent times, and Meath is no different. Before Christmas, we witnessed a tragic situation where 7 men died by suicide within 10 days in the county and left communities such as Kildalkey, Atboy, Trim, Kells and Duleek in shock and in grief for that period of time. And I believe we actually need to start asking ourselves really serious questions as a society with regards to what's happening here. In many instances, some of these issues with regards to mental health are very difficult to resolve and not necessarily our gift here to resolve. But some are, and we need to make sure that, first of all, as a state, we've tackled the socio-economic reasons that lead to some people suffering from mental health issues and make some people believe that suicide is the only answer for them. But what is in our gifts in this country is the health service and how we actually treat and support people suffering from mental health. And every county currently has obviously reason to complain at the moment. However, Meath, again, with regards to resources, is at the bottom of the ladder in this area. Now, take, for example, I found out just recently that there are 32 staff vacancies in the Louth Meath Mental Health Services before Christmas. The Chief Officer of the Louth Meath Health Organisation has confirmed to me that these 32 vacancies are in a range of different grades regarding psychiatric nurses. And this figure is inordinately high, and it's extremely worrying that you would have that absolute gap with those key medical professionals in this area of crisis. This summer we found out that the child and adolescent mental health teams in the Louth Meath area have just over half the staff, Minister, that they need to fulfil their duties. In Midlands, Louth Meath, there are over 50 children who are waiting over a year for their first appointment. There are 50 children in our area waiting over a year for their first appointment. And Minister, you must understand that mental health issues are an urgent issue. They're an issue that needs support and treatment fast to make sure that things don't get worse for those. Now, that figure is the second highest rate in the state and has grown significantly over the last 3 years. So this is not something that the government is inheriting. This is a problem that's been created by the government's lack of ability, inaction and lack of funding to deal with it. And we know that this is obviously unacceptable, and Meath is an outlier in how bad things are in the country. But Ireland is an outlier with regards to how bad things are for teen suicide in the EU, with us as a country being 4th highest in that regard. The HSE confirmed to me in September that mental health spend in Louth Meath was the 2nd lowest per capita in the state, at €121.67 per capita. The 2nd lowest. So it's not hard to join the dots here, Minister, that when you invest so little in a particular area, when you employ so little staff in a particular area, that you would have rates of suicide and mental health so high in that particular area as well. So, you know, every community has obviously been affected by teen suicide. It's clear to me that the government is either unequipped, unable or not sufficiently motivated to tackle the problem. And as a county, Meath are again at the bottom of this resource list. We need to make sure that there is radical investment and resources and energy put in by the government to start to tackle this problem in counties like Meath.
Minister has 4 minutes.
First of all, can I apologise for Minister Daly, and I would like to thank the Deputy for raising this very important and serious issue. The recent budget provided an additional €55 million to progress new developments in mental health this year, which brings the overall HSE mental health spending to nearly €1 billion in 2019. This in turn will allow for the continued improvement to all aspects of mental health care across the HSE community healthcare organisations, including CHO 8, which incorporates County Meath. Louth Meath Mental Health Services continue to strive to improve the level and quality of services being delivered, and also the environs in which it is delivered. It supports clients in their recovery and rehabilitation as close to their home and community as possible. All of this is done within the resources available, referral to community psychiatric services through general practitioners. There are a range of options provided by Loudonmead Mental Health Services to the population of Meath. Acute inpatient beds for Loudonmead are located in the Department of Psychiatry, Cross Lanes, Drogheda. Referral for assessment is either through a GP or through A&E. In relation to community adult outpatient services, 3 teams are based in Thorn, covering Navan, Kells and the Trim area, and 1 team is based in Ashburton. The Psychiatric Day Hospital Services covers Navan Hospital and Ashburton Primary Care Centre. Examples of services provided from the Day Hospital include stress management, cognitive behavioural therapy, family therapy, alcohol counselling and collateral clinic. Therapeutic interventions in line with national clinical care programmes are also being delivered, which includes, for example, first episode psychosis and eating disorders. The team is currently being established. The Day Hospital provides an enhanced package of care to clients in the community, all of which is in line with a vision for change. A community high support residence is based in Rothnaree, Leesbrook Lane, Navan, and there is an assertive outreach team for the County Meath providing continued supports to clients in their own community. The team is now currently, I'm told, moving to a 7-day service. In addition, a home-based treatment team provides support to acutely unwell patients in their home. Other services available in Meath population include the psychiatric of old age team based in Kennedy Road, Navan. There is an advanced technology room for persons with dementia. The Child and Adolescents Mental Health Services located in Hazelhouse, Navan and Trim Care Centre. The recently agreed HSE Service Plan 2019 outlines the priorities and actions to enhance mental health care nationally this year. This relates also to CHO 8 and County Meath, which is a range of services covering acute or community-based child and adolescent mental health services, general health services and psychiatric of late life. While the service plan also acknowledges widely accepted challenges to developing services, including increasing demands and difficulties around staff recruitment and retention, the objective for me and the HSE is to deliver an overall service improvement this year. Thank you.
Deputy, 2 minutes.
There's no doubt, Minister, that there are good people doing good work in County Meath, and we applaud them. They're dealing with a tsunami of need at the moment. And a vision for change is really important. But if we don't have the funds for change, it's not worth the paper that it's written on. And right now in Meath, we have 3 government ministers in various guises, and we have 2 Fianna Fáil government backbenchers as well in Meath. And yet we're not getting the funding. Yet Meath is an outlier with regards to the level of vacancies that exist in key and critical healthcare professionals grades. And it is an outlier with regards to the lack of funding that we're getting per capita. Do you not agree, Minister, that it's really hard for these healthcare professionals to function and carry out their job with regards to the level of need that they have if they don't have the adequate resources to do it? And we have an opportunity as a state in this time with regards to the economy to be able to intervene in so many individuals' lives, to bring people back to good mental health and to intervene to make sure that they don't go down the road thinking that suicide is some kind of solution for their situation. But we can only do that if we have the feet on the ground and the funds available for them to do it. And despite the rhetoric that we experience year after year, the figures are getting worse. And, I was looking at figures there recently. The rate of self-harm in 2016 is 10% higher than it was in 2007, the year before the economic recession. And the rate was highest amongst the young. And unfortunately, the reality across the country is 1/3 of children's mental health beds are currently closed. They're closed, Minister, due to staff shortages in child and adolescent mental health units. And again, I go back to that issue where you have psychiatric nurse vacancies and you have 52 children who have been waiting for more than a year for an assessment, just an assessment for a child and mental health service. If we have to tell a child, don't come near us for 12 months before we will even talk to you with regards to your mental health services, well then we are failing those children radically.
Thanks, Deputy. Can I say that Minister Daly wishes to reiterate the improvements of all aspects of policies and services for promoting positive health nationally. The Deputy will be aware, of course, that Minister Daly has met with him in the past on the issue that he has raised. In addition, Minister Daly's office has, within the last few days, been in touch about arranging another meeting with you, Deputy, which he asked me to say to you today. And of course, if you need to bring all relevant local representatives to that meeting with you, that would be fine. And that would again be to review mental health services in Meath. And Minister Daly has asked me to tell you that that meeting will take place as quickly as possible with yourselves. So maybe if you were to contact with your office, Minister Daly, he says that this meeting will take place as quickly as possible. Minister Daly continues to continually liaises with the HSE to monitor all aspects of mental health care, including implementation new initiatives agreed under the Executive Services Plan. And again, as I would say that the recent budget did provide an extra 55 million to progress new health developments in mental health, and which brings it up to exceptional money in 2019, which is just over 1 billion. And again, just to inform the Deputy that the construction of the National Forensic Mental Health Complex, Portain, is progressing with the facility to open in 2020. All aspects of CAMS nationally are being improved by the HSE to, of course, improve. I know there are difficulties there to improve access on the waiting list. So, Deputy, your points are well made and well taken. And I did meet with the Minister yesterday to discuss them, and he has said to me that he would be glad to meet you and representatives and whoever in that area represents the community, the mental health community or the health community, and that meeting will take place as soon as possible.
Thank you, Minister.